Hello everybody who's joined our annual general meeting. We'll just wait a minute or two just to give any other members of the public an opportunity to join us. So I'll just give it another 30 seconds or so, but thank you very much. So I'd like to welcome everybody to our annual general meeting and to the agenda that we have for today, which is laid out in front of you. We have a set of minutes from our 1920 AGM that is presented for approval. These are on the EEAST website and I invite you to take a look. I'll take them as read though, we haven't had any comments provided, but if there are any matters raised by the end of the meeting, we can talk about them and respond to them then. So we have only got an hour to cram in all our highlights, and the executive directors are going to be talking about all the aspects of EEAST in turn, and they're going to be clustered under our 4 strategic goals. Each director will introduce themselves and the sections they're leading. We're really interested to hear what you think and answer any questions and any inquiries that you may have. So please feel free to add your questions and comments in the chat box, and we'll pick them all up at the end. You will notice by now that you can hear me but not see me. That's the limitations of our technology. It's really a case we've had to choose between me or the presentation. We thought actually the presentation with pictures and stories from our staff and our environment would be more useful than just looking at me for an hour. So you will only see the presentation, but I hope that's acceptable to you. We're fairly well versed now on using the technology. Hopefully it doesn't crash, but if it does, we will get it restarted again very promptly. So if for some reason it does go down, please rejoin us as soon as you can. To let you know that the AGM is being recorded because we do want to put it on our website to make sure it's fully accessible to all of our communities, and there'll be a link on there for you to see later. So moving on to the first slide then. As we reflect on our services over the past year, we've really been overshadowed by the global pandemic. So the first thing obviously is to say is a massive thank you to all of our colleagues, volunteers and partners. Just everybody has contributed to delivering such an excellent service to our patients in really the most challenging circumstances that the NHS has ever faced into. But these circumstances have challenged us both personally and professionally. So it is with sadness that we remember the impact of COVID-19 on all our colleagues and send our heartfelt condolences to the families of our colleagues who have suffered bereavement due to COVID-19, and we will miss them all. We are proud of the dedication, passion, commitment and compassion of our colleagues, and as always, true to our core values and our vision to deliver outstanding care with exceptional people every hour of every day. The response to the pandemic has been truly exceptional, and we really hope that you enjoy reading about some personal stories highlighted within the annual report. Our AGM is supported by both our annual reports and accounts and quality accounts. These documents provide you with the detail around our year, and they can be found on the EEAST website. I really recommend that you have a look at them. And I really want to thank all the colleagues who are involved in producing these excellent reports. They've really step changed since previous years. So I know it takes a lot of input from a lot of people to pull them together. So thank you for the excellent teamwork. But when we mention EEAST, you may think that we're only about 999 ambulances and crews, and that's often how it's portrayed on the TV. But there's just a massive part of the service we deliver, and there's many more people that work across the organisation to deliver our excellent services. And you may be surprised to know that we do those over 6 counties, as shown here. And they include non-emergency patient transport services working in partnership with our acute hospitals primarily, volunteer services with our community first responders, resilience and specialist operations. We are a health education provider. We also generate our own income through selling specialised services. We do lots of research, and we also do telephone and online clinical advice. There are so many different jobs in these, from mechanics to first aiders, and not all 999 focused. We also, of course, provide the paramedic crews for all air ambulance services, which are provided through our charity partners. We serve a resident population of over 6 million people, and those of you out there who live on the coastal regions will know how those numbers change quite significantly during the summer period and then other times in our major cities. due to the influx of tourists and also workers during the day. On a daily basis, our actual population numbers shift significantly. But as a team, the board has been entirely focused on providing outstanding care to our patients and supporting the development of our communities through its partnership work. I'd like to thank Dorothy Hussain, who left the Trust in the new year, for her strong commitment to making sure we have the right outcomes for our patients. I'm delighted to say, though, we have moved on to appointing a new CEO who's been in post since the beginning of August, and Tom Abell will be giving his insights and reflections at the end of the AGM. He joined from Mid and South Essex NHS Foundation Trust, where he was Deputy Chief Executive. Of course, he takes over the reins from our Deputy Chief Executive and Medical Director, Dr. Tom Davis, who led the service brilliantly as Interim Chief Executive since last September, almost completing the year in the role. So many thanks to Tom for all your hard work in keeping EAST on track. Your efforts were magnificent, and we say a heartfelt thank you to you. And on this slide, I just wanted to introduce you to the whole board, who are a delight to work with. They bring a strong range of independent expertise and assurance from the NHS and other sectors to the overall leadership of the Trust. So since we launched our strategy, Our People, Our Trust corporate strategy last July, which was worked up in collaboration with our colleagues, patient representatives, volunteers and charity and emergency service partners, we've achieved many significant improvements, and they are covered in our annual report. But we are looking forward to building upon these improving relationships to finalise our patient and public involvement strategy, which will enable our representatives from patients and colleagues and stakeholders to collaborate further with us to set our vision. So we continue to focus on our journey of transformation, which allows us to work collaboratively to deliver service improvement further and faster than previously we thought possible. We are fully committed to the importance of building strong partnerships to support the emerging and future requirements of our NHS partners across the regional integrated care system landscape. So just to give you a couple of examples of our strengths in collaborative working, we have highlighted a number in the report, but which deliver great patient care, but a couple for me are the mobile stroke unit and early intervention vehicles across the region. And it's important to note in today's climate that another area that we've introduced in the annual report is significant work to support the sustainability ambition of the Trust. We've added more sustainable vehicles to the fleet and introduced a hub of electric charging points, as well as supporting the national pledges, including the NHS's commitment to being net carbon zero by 2040. So on my last slide, I wanted to just highlight that in June, the Care Quality Commission undertook a focused well-led inspection. As a result of these weaknesses identified by the inspectors, the Trust was placed in special measures in the autumn, although our previous rating of requires improvement, which also contains a rating of outstanding for the care we give, remains unchanged. The Trust fully accepts the findings and recommendations. We immediately put in place improvement activity, and more recently we've been focused on making sure the changes are changes for good. This slide identifies the 5 key themes of our improvement path towards excellence, with a real focus on introducing ways of working that are sustainable and make an enduring difference to our patients and colleagues. We are absolutely committed to making sure that we change for good. So our vision of outstanding care, exceptional people, every hour of every day is extremely important and provides our overall compass to navigate our priorities. I'm now going to hand over to Paul Marshall, our Deputy Chief Operating Officer, who's going to talk about the environment in which we delivered our services last year. Thank you, Paul.
Thank you, Nicola. Excuse me. So, hello everyone. I'm Paul. I've worked for EAST for 6.5 years now, having had 2 previous careers, the fire service and private industry before joining. And I'm here on behalf of our Chief Operating Officer, Marcus Pace. Last year, of course, was most notable for the COVID-19 pandemic, where we implemented and developed a number of contingency measures to support our ongoing delivery of services during these extremely challenging times. These included recruiting more colleagues, greater collaboration with partners across the system, and introducing new ways of working. These initiatives provided additional resources for us to respond to our 999 calls during the peak pandemic period, including a dedicated transport service for critical care patients across the whole of the east of England, working with a range of partners across the health system. We flexed capacity with the aid of system partners, and we responded to the challenges our staff faced by introducing different PPE, restricting exposure to our more vulnerable staff, and putting in COVID safe measures across all our estates. Some changes were planned prior to the pandemic, and some were part of the response to the pandemic. As part of the planned replacement of our ageing fleet, for example, our fleet department has invested nearly £50 million in putting 440 new ambulances on the front line. Now, these are aligned with the new national specification for ambulance services, and our fleet department worked extremely hard to find a solution which fits with the national specification and is suitable for all our staff to use. As part of the response to the pandemic, we managed to bring forward some discussions on joint working with the fire and rescue services across the region, where the fire and rescue service assisted us by driving our ambulances, allowing our clinicians to focus on the patient, as well as a joint responding to patients in the community where concerns have been raised. None of our operational activity would have been possible without the many staff supporting the frontline operations. And this includes adapting to low-level decontamination whilst the ambulance is parked at the hospital. Not only does this ensure we respond to our patients in an appropriately clean and disinfected vehicle, but it allows our staff to be available for the next patient quicker than they would have otherwise been. However, during this unprecedented challenge to the ambulance service and the wider health service, we were still able to respond to over 1,999 calls we answered, and actually attended nearly 827,000 incidents across the region. The calls are taken by our dedicated 999 call handling staff in any one of our 3 ambulance operation centres, where we have automated built-in resilience. So if all the staff in one centre are already on 999 calls, the next call automatically diverts to an available call handler in another one of our centres. We were able to find alternate care pathways for approximately 10% of those callers through our hear and treat capability. This is where we have a number of senior and experienced clinicians based in our ambulance operation centres. They review the call, they speak to the patient and find them alternative solutions to help them, which would include the use of a pharmacist or a GP or another alternative patient pathway available in the community. And we are one of the top performing ambulance trusts in the country for managing our patients safely through hear and treat. Of the circa 827,000 incidents we attended, 9% of these, at 73,605, were categorised as the highest priority, i.e. immediately life-threatening. And the vast majority, is 59%, 490,903, were our second highest category. That's over 500,000 very unwell patients our amazing frontline staff attended to last year. And how well did we respond? Well, the national standard for responding to the sickest patients is an average of 7 minutes, and 9 out of 10 of them within 15 minutes. In our region, we responded to our sickest patients in an average of 7 minutes and 1 second, and 9 out of 10 of them in under 30 minutes. Now, as I'm sure you are aware, we are not only an emergency ambulance service, we at EEAST also operate a number of non-emergency patient transport services across the region, namely in Essex, Hertfordshire, Bedfordshire and Cambridgeshire, where we transported 426,000 patients on journeys, mostly within our region. The majority of these journeys are pre-planned to support patients who would otherwise have been unable to attend an appointment. However, of these 426,000, approximately 30% were requested as on-the-day discharges. Under normal circumstances, this is really challenging, balancing the number of resources we have available to deliver a cost-effective and efficient service with having enough resources to manage the on-the-day demand. But this has been made even more so during the pandemic response, because in order to maintain the health and safety of the patients using the service, we have had to reduce the average vehicle utilisation from 3.7 patients per run to 1.4 patients. This is where we will, if suitable, transport more than one patient on a run, either to or from their appointment. However, COVID restrictions have meant us reducing the number of patients we can transport at one time. To maintain the 1 metre social distancing rule to keep our patients as safe as we can, to facilitate this, we have introduced enhanced call screening questions for symptom check-in. Plus, our crews also symptom checks, that is temperature check, our patients on arrival to mitigate as much risk as possible and in keeping our patients safe. During the first wave of COVID and national lockdown, we saw the need to adapt our focus on transporting our most vulnerable and high-risk patients into urgent or life-saving treatment, with supporting the hospital flow through the pandemic with discharges. And over the last few months, where everything is opening up and clinics work through the backlog of patient treatments, we have seen our activity go back to normal levels within our standard service. However, we continue to maintain the 1 metre rule and reduce number of patients on our resources, increasing these when it is safe to do so to ensure we can meet the high demand. The patient transport service is not available to everyone, just those that meet the criteria for that service, and this is determined by our call list, but more about them shortly. Firstly, I'd like to tell you a little bit about our resilience and specialist operations team, who have at their disposal VW transporters and Mercedes response vehicles, a Polaris 6-wheel drive vehicle, welfare vehicles, and crew carriers. The HART, that's the Hazardous Area Response Team, attended 3,246 incidents over the last year, which have included incidents involving hazardous materials, working in confined spaces, water-related incidents. You may remember some news headlines of people unfortunately getting into difficulties in some of our waterways when we had some hot weather, working in at height incidents, and supporting the police at times, plus a number of conventional 999 incidents. They attended over 2,000 flood-related incidents in Bedfordshire and Cambridgeshire, and utilised the Polaris for patients who were a long way from the road, for example, farm or forest-related incidents. The team also maintain a number of national interagency liaison officers, NILOs, who are trained to support and advise incident commanders, so police, fire, military, and any other government agency on our operational capability. This would be at major incidents, complex or protracted multi-agency incidents, any other situation where they may be beneficial, for example, CBRN incidents or counter-terrorist incidents, or royal visits or heads of state who may fly into one of our airports in the region. As part of the specialist operations, we have approximately 300 staff trained to respond to a marauding terrorist attack, or CBRN, which I mentioned earlier, which is the chemical, biological, radiological and nuclear incidents. Fortunately, we do not experience many of these, but we maintain our preparedness so that when we do, we are able to respond appropriately with trained personnel, and they get their training throughout the year. In addition to the responding, the team also deliver Commander Foundation courses to support our officers to take on the role of commander at an incident. Plus, we'll be leading on a number of MTA exercises over the coming 12 months. They also support our operational teams at resilience forums and help embed learning. For example, they are currently ensuring lessons from the Manchester Arena attack are embedded within our operational delivery to ensure, should an incident of this nature occur within the East of England, both the Trust and its staff are as prepared as possible. So hopefully that's explained a little bit about our operational capacity and capability and how our service has been used over the last year. As already mentioned, this past year has been unprecedented due to the responding of the world by pandemic, and we have been helped by Call East, Specialist Customer Service Solutions. Call East is a contract centre based within our Norwich Ambulance Operations Centre and receives more than 800,000 calls each year. It's staffed by a team of 62 people and is currently managing 79 different contracts. Within those contracts are our patient transport service contracts, where Call East operates to check the eligibility and booking for the patients accessing the patient transport contracts. Call East offers a bespoke service for call handling, booking and screening, non-clinical triaging. They have virtual receptionists and signposting, and have recently added text, email, social media and web-based services to their portfolio. The 79 contracts are across a range of organisations, not just health and care, but also includes technology services, vets, legal services, and even a supermarket. Call East is part of our commercial offer. However, moving back to our emergency service operations, this is all in place to respond and provide outstanding care to our patients. Remember, every single one of those calls we receive is a patient. At the end of every single one of the circa 827,000 incidents we responded to, there was at least one patient and sometimes multiple patients. One of our 4 goals is to provide outstanding quality of care and performance to every single patient needing our service. I'm going to hand you over to Juliet Beal, Director of Nursing, Clinical Quality and Improvement, who will tell you a little bit more about how we cared for our patients last year. Juliet.
Thank you very much, Paul. So as Paul said, I'm Juliet Beal and I'm the Interim Director of Nursing, Clinical Quality and Improvement. So my slide starts off with saying patients are the heart of everything we do. And that's the mantra that all of us want to keep in our mind as we care for patients. We want patients to be cared for in the same way that we would care for our loved ones, so our mum, our dad, children, sons, daughters, friends and relatives. And it's very important to us that we have the highest clinical standards possible. And I'm going to tell you a bit about how we've done in the last year. The next slide just takes a little bit of explaining. So these indicators are the indicators that all ambulance services are on, and we're measured mainly on how we respond when a patient has a cardiac arrest or when their heart stops. Now, it can be two ways. It can either be a cardiac arrest, which has been seen by somebody else, or a cardiac arrest that hasn't, and we measure that slightly differently. The other thing we look at is care bundles around heart attacks, strokes, and when a patient has sepsis. So if I can explain how we're doing, we are the highest performing trust for patients where we witness a cardiac arrest for their survival to discharge, and that's the highest performing trust for ambulance services in the country, and we're really proud of that. And you can see the difference between how we do and the national average, which is on the slide, and that average is taken from all ambulance trusts. We're the second highest performing for trust for when a patient has had a heart attack and the care that we give them after that and taking them into hospital. We've done a huge amount of work on our sepsis care bundle to ensure that all our crews think sepsis when somebody is really unwell, and actually put a special care bundle in place to do observations to make sure that they have the best chance of survival and a good outcome. So we're really pleased to look at the outstanding quality of care, which actually crews have delivered, and as Paul has said, under difficult circumstances during a pandemic. I want to just talk to you a little bit about compliments and complaints. So we receive a lot of compliments, which is absolutely fantastic, and we really value the time that patients take to write into us. And we look at compliments and pass them on to the crews who have received them. We receive about 4 compliments for every complaint, and we've actually seen a really significant reduction in complaints over the last year. It's important to us that when somebody does complain to us that we respond quickly, and the complaints team will often phone someone or email them straight away so that we can see if we can sort things out quickly. We do regular surveys among our patients to see how well we've done, and it's fantastic to report that over 95% of our patients told us that we've done a really good or outstanding job. And you will see that we were rated as outstanding for our patient care with the last CQC report. That doesn't mean to say that we always get it right, and when things go wrong, we talk to patients about what happened, and we also hold what we call a round table with the crews who have been involved so that they can discuss what's happened and to learn from it, and we share that learning across the organisation. It's very important that we keep that patient voice at the centre of everything we do. These are some of the compliments that we've received, and you'll see that we receive compliments across the whole organisation. So both with call handlers that Paul was talking about earlier, and some of our CFRs who are our community responders, who are volunteers who are specially trained to respond, as well as our frontline crews. It's important to us that everybody is treated with dignity and compassion, and what is a really difficult experience for people is made as good as it possibly can be, and that people take away the fact that they feel cared for and looked after and have had really good care. So some of the things we've done, we were the first ambulance service in the country to employ specialist social workers, and this has really helped us to support crews and to support people with adult and child safeguarding concerns, and to make sure that they're dealt with really quickly. We've published a number of new policies, and these have been socialised with our staff so that they can make sure that they really understand the policy through management passport training. And that training is online and it's in bite sizes so that managers can do that training in their own time when they get a little bit of a break at work. We've also developed a really good partnership with the fire and rescue services. So when we've been out to somebody to do a safe and well check to make sure that somebody is all right, with their permission, we tell the fire service about them, and they go out and really help support them to make sure that their home is safe and that fire safety is in place. And more recently, the fire service has also been helping us with elderly people who have fallen at home to make sure they get a quick response. In order to provide outstanding quality of care for patients, it's really important that we look after our staff. And as Paul was talking about, it's been very challenging with COVID. We've wanted to ensure that all our colleagues have been able to work safely and have been wearing the correct PPE and understand how to keep themselves safe and their patients safe during the pandemic. We've increased the amount of infection prevention and control practices we do. So, for example, we've really increased the number of vehicle cleanings and audits. And we've also introduced COVID marshals to ensure that we work safely. The COVID marshals go out and inspect all our stations every week to make sure that we're providing the best and the safest service possible and keeping our staff safe. The other thing I think we should mention is about violence prevention and reduction. Very sadly, we do see some amount of violence towards our crews, and we are absolutely committed as an organisation to prevent that. To that end, we spent some of the year looking at how to implement a pilot around body-worn cameras, and I'm very pleased to say that that will be starting next month. We continue with our patient safety. You can see the picture of the ambulance with the 6,000 outside it, and that is our vaccination team who are celebrating vaccinating over 6,000 members of our staff, over 95%. We have most of our patient safety incidents that are reported don't cause harm, and what we aim to do is really understand our patient safety incidents so that we can prevent any harms happening in the future. And of course, we have an absolute duty to tell people when things have gone wrong and to share any reports we do around serious incidents. These are some of our real highlights. So during the year, we introduced something called cuddle pockets, and these are individually handmade wraps for babies who have been very sadly lost. And that enables their parents to hold them during the journey to hospital in a dignified way. And in fact, this has actually been rolled out with other ambulance services. Our crews are so committed to patient care that they not only do things during work time, but they also in Ipswich have been knitting for vulnerable patients during their own time, making blankets and twiddle muffs, which are used by patients living with dementia to have sensory experience. We've introduced patient safety boards so that we can continually learn from patient safety incidents and things that happen and share good practice with all our crews. And we've also introduced a patient safety newsletter. We've appointed some mental health advanced practitioners to ensure that patients presenting with mental health issues get the best possible care, the best response to their needs. And we've also introduced a number of strategies around disability and autism. The Respect project is for patients who are experiencing domestic violence so that they can get the right input put in as quick. So thank you very much for listening to the quality of care. I'm now going to hand over Champion, who is our Director of Workforce, and he's going to be talking about outstanding care, exceptional people every day, every hour, and being an exceptional place to work. Thank you.
Thank you, Juliet. Hello, everybody. I'm Bob Champion, Interim Director of Workforce. I've been working with it since mid-April this year and have been very pleased and proud to have joined an organisation that is committed to positively responding to the challenges it's faced over the past year. As a former paramedic, I'm particularly pleased to be back in an organisation in a role that I can help to influence how we treat our staff and how the impact of the way we treat our staff affects patient care. And I'm very keen to see that any people who work within my team have a direct line of sight to the effect they have on patient care, so that we keep it real and we make sure that we're making a positive contribution. And I'm very pleased to be working with a very hard-working and dedicated workforce and organisational development directorate team. Thank you. See a breakdown of the workforce by service area, age profile, and some of the main protected characteristics that we report against. With almost a 50-50 split between colleagues identifying as males and females, this is untypical of the trend for the majority of NHS organisations, which tend to be more female dominated. But for ambulance services, we have a higher number of female colleagues, and that's a good indicator of the diversity of the workforce. The largest group of staff by far is 3,850 colleagues who deliver frontline operational services, with ambulance operation centres coming in a close second with just over nearly 800 staff. We've also got a relatively young workforce, with over 3/4 of our colleagues being below the age of 50. Whilst we're investing in our positive culture change and promote staff networks, we can do more in relation to developing a more diverse workforce with regard to ethnicity and disability. With a ethnic minority contingent of just 3% of our workforce, we're not reflective of some of the communities that we serve, and we recognise that. So we need to work within those communities to make the ambulance service careers more attractive and accessible to all. And we also need to improve the confidence of those colleagues who choose not to disclose their ethnicity, as 14% of unknown disclosures may mask a high proportion of our ethnic minority staff. Apart from the successful establishment of the Freedom to Speak Up Guardian service, we have actively encouraged our staff to speak up, speak out, and call out unwanted or offensive behaviour in the workplace. Our Dignity at Work policy, which covers prevention of bullying and harassment, is designed to facilitate the raising of concerns about poor behaviour in the workplace, including harassment, and how it successfully brings people who conduct themselves in a way that's either offensive or unwanted to formal processes, and to support individuals to feel safe and secure in their workplace. As well as the Freedom to Speak Up mechanism, we regularly solicit the views of our colleagues through quarterly pulse surveys and other periodical surveys to assess how colleagues feel that we are tackling the issues that affect them most at work. We also aim to encourage a stronger participation in this year's National Annual Staff Survey, and expect that through demonstrating some of the improvements that we made in the workplace we've made since last year's survey, our colleagues will recognise this and help us to improve our rankings in the 10 key themes of the staff survey. The health and well-being of our colleagues is a priority, and we work very hard to make improvements to our occupational health service and employee assistance programme. We also continue to provide in-house support via our small wellbeing team, and particularly during the height of the initial COVID pandemic, our wellbeing team was particularly active in going out and supporting staff on stations. And we're also investing in significant improvements and expansion of our resources in-house as far as the wellbeing service is concerned for the coming year. We also introduced and supported the development of wellbeing ambassadors from within the workforce, and these colleagues have grown into an effective resource to support other colleagues and signpost them to resources and facilities to improve their health and well-being, both physically and mentally. We had a good uptake for our flu vaccination campaign, and as Juliet mentioned previously, with our 95% of our staff receiving 2 COVID vaccinations, we were the highest performing ambulance service in the country. We've also improved our trauma risk management offer, with access to referrals increased, and secured the services of 4 volunteer chaplains to help with the pastoral care of our workforce. Next, please. We supported the establishment of 5 staff networks and encouraged our colleagues to join them and participate in their activities. Our cultural ambassador scheme enabled us to independently scrutinise our recruitment and formal processes to ensure the consistent application of policies and procedures and the elimination of bias and discriminatory practices. Our workforce race equality scheme and workforce disability equality scheme data showed that we have more to do in the areas of equality, diversity, inclusion, and the Trust Board is keen to see and support ongoing actions to improve our position across all of the indicators. Okay. Charitable funds are very gratefully received from a number of sources. I'm sorry, I've lost my place there. We have many talented colleagues and volunteers, and here are a few stories from over the last year. Paul Henry, our Deputy Director of Operations, was awarded the Queen's Medal, and Doug Bishop and Jonathan Poole went above and beyond the call of duty when they tackled a fire in a top floor flat by evacuating the building. Moving on to our volunteers now, sorry. Our volunteers come from a variety of backgrounds and even includes members of our own workforce in non-clinical roles, volunteering for positions as community first responders. Charitable funds are very gratefully received from a number of sources and are all put to good use. As well as income from the Captain Sir Tom funding, we get donations from local and regional benefactors. The Charitable Fund Committee of the Board ensures appropriate governance and scrutiny of the spend, and the staff-based Charitable Funds Working Group receives, reviews and prioritises requests for local expenditure. More recently, expenditure has been common to provide well-being facilities for our colleagues, including a garden in Huntingdon. And here are some more areas in relation to our volunteer activity. We celebrated International Volunteers Day, and it's a recognition of the way that firefighters have supported us, particularly with helping to drive vehicles during the pandemic. And finally, our 4th goal is to be an environmentally and financially sustainable organisation. So I'd be delighted to introduce you to Tom Davis, our Deputy CEO and Medical Director, to take over from there. Thank you.
Thank you, Bob. And before I pass to Kevin for the sustainable goal, I'm going to talk about partnership and system engagement. Before I do so, I wanted to firstly thank Nicola for her kind words and support throughout my tenure as the interim chief executive, and to thank the board, but more importantly the whole organisation, for the support and absolute dedication that helped me do the job that I was tasked to do in what has been probably too often now termed unprecedented times for both the NHS, but also we've heard for this organisation in the context of special measures and the very serious and distressing challenges that we have around our culture and behaviour throughout the organisation. It is a privilege to be a chief executive of a health organisation and absolutely equally of an ambulance service. As a medic myself, it's been a real pleasure to lead dedicated and focused professional clinicians who have done everything that they can throughout the years I've been here to support our patients. But we can't do it alone as an organisation, and I think the emerging health service out of the pandemic, but also the experience that we've had as part of the pandemic, absolutely has accentuated the need and the benefits of this organisation and our patients in us working in partnership and engaging across the system. So as we move to the next slide, I wanted to just highlight some of the areas of partnership working. But before I go into specifics, I think I'm very keen to describe at a strategic level the partnerships that we have enjoyed and our patients have benefited from and our staff have benefited from over the last year. The obvious one being NHS partnerships, and we've worked very closely both with the ambulance sector nationally and our regional colleagues in all areas of health, not limited to, but very much focused around the integrated care systems and partnership working. But it's not unique to the NHS partnerships, and tomorrow I'm speaking at an emergency services commemoration, and tomorrow is the emergency services day, and we've absolutely benefited from supporting our staff and patients through partnership working with our blue light partners, the police, the fire, and our military colleagues, many of which not only support us through their professional roles, but also in many volunteer roles. Some specifics as we move forward, and clinically there are some fantastic innovations that are driven through partnerships. Our mobile stroke unit is one that I've had a lot of awareness of as it's developed, and has absolutely benefited a small number of patients to a great extreme in rural areas where a stroke unit arriving to the patient has been critical in their treatment pathway compared to their travel into a hospital. We've also worked with our Coast Guard colleagues, especially on the eastern coasts of our organisation. I say that knowing full well that there aren't many western coasts of the east of England, but we've worked very hard with our partners there to provide care to patients using the support of the volunteers in the Coast Guard. We've got a number of internal partnership workings. Juliet's talked about our safeguarding team and the working alongside social workers who have become part of our organisation. We've also got many mental health clinicians and experts within the organisation, both working in our control rooms, but also in some innovative and exciting progressions in the delivery of mental health through mental health response cars, mental health schemes in Cambridgeshire and Peterborough, for example. We've also got a number of early intervention vehicles. These are vehicles that combine the skills of paramedics and therapists, mainly occupational therapists, but also social workers, and are focused on supporting our lower acuity and more vulnerable patients who may not need hospital care, but may and often do benefit from the expertise that the therapists and our own clinicians deliver to them in the home. One of these examples in Norfolk and Waveney has led to that system, the Norfolk and Waveney system, being recognised for some of the leadership and system innovations, of which an early intervention vehicle is one. And I've mentioned the fire and rescue services. Not only have we worked with them to combine the expertise that they bring when visiting patients' homes, but we've also, throughout the pandemic and beyond, seen the benefit that their expertise, both in driving skills, but also in their trained clinical skills, can bring to supporting our crews in extremis that the pandemic has brought to us. So it was a whistle-stop tour of some of the partnership working. As I said, it's been an absolute privilege to lead the organisation at a very challenging time, but whilst it's easy to be distracted and absolutely we should be focused on the challenges, there are many good examples of how the organisation has worked in partnership and our patients have benefited and our staff have been able to expand and develop their skill sets through those partnerships. So I will now pass on to Kevin Smith, our Director of Finance, who will talk to us about our fourth goal, being environmentally and financially stable as an organisation, or sustainable as an organisation. Thank you, Kevin.
Thank you, Tom. Yes, as Tom mentioned, I'm Kevin Smith. I'm Director of Finance and Commissioning. And although a director for the last few years, I've actually been with the Trust since its formation in 2006. And I think worth saying that despite the challenges of that time, I've been privileged to see the achievements of and the fantastic care that our staff provide over that time. I think given it's such an important topic these days, I wanted to highlight some of the work we've been doing in relation to sustainability. Next slide, please. Thank you. So in the last year, we've appointed a dedicated sustainability manager and also agreed a sustainability strategy in November 2020. And this has led to the production of our green plan, which we aim to take to board for approval this autumn. We've taken action to reduce our carbon footprint in areas such as energy consumption, fuel consumption, but also looking at waste recycling and reduction. And this programme of work will continue with a lot of initiatives from our new sustainability manager. In particular, we are looking at increasing the use of low and zero emission vehicles, and has also begun work on establishing an electric charging stations network across our trust estate. Thank you. This slide shows some of the further work we've been doing in this area, and we are particularly proud of developing our Green Champions network with 45 champions already engaged, covering all areas of our patch. Green Champions are colleagues who are really passionate about doing their bit for the environment and will help inspire others to be more sustainable in the workplace, promote environmental awareness, and as Nicola said at the start of the presentation, help the NHS reach its target becoming net zero in 2040. I think we've flipped off the slide, but the previous slide did show a number of the schemes that we've been doing, and I think thank you, Emma. I think some particular items to note there. Thank you. So turning to our financial performance, despite the considerable challenges that imposed on the NHS by the COVID pandemic, we are pleased to report that we achieved a break-even financial position for the year, in fact a small surplus. This is largely due thanks to significant additional funding provided to the Trust from NHS England via our CCG partners. As you can see from the slide, expenditure rose to over £400 million for us as an organisation, of which around 50 million was attributable to COVID-related costs, such as additional PPE and equipment, cleaning of both vehicles and estate, additional cleaning, I should say, but also expenditure on significantly on additional vehicles and staff, particularly call handlers and drivers. We also received massive support from our staff by going the extra mile and with additional overtime in many of the areas across the trust, if not all. Despite the challenges, we still managed to make over 7 million in cost improvement measures during the year. And also we were able to invest over 11 million in capital expenditure to further improve our estate and IT equipment and systems. That capital expenditure is across about 50 individual projects, and I think sort of key ones to note, around 1.5 million on the new electronic patient care record system, which we're rolling out, and around £1 million on replacing the trust telephony system. Around £500,000 on upgrading our uninterruptible power supply services to 3 of our key sites to really increase our resilience in the event of power failures. But also probably worth mentioning around just over £1 million on new defibrillators, which we continue to replace on the programme. But particularly, and we did get additional funding for this, was around 700,000 on 38 critical care stretchers as part of the response to the COVID pandemic. Finally, just to mention that it's important that the Trust's external auditors are able to conclude that our accounts for the year represent a true and fair view of the Trust's financial position, and they were able to conclude that, which is very important from a governance and regulatory point of view, and certainly as an accountant. Just to mention, we were all able to achieve all our statutory financial targets for the year. Briefly, the first 2 that I mentioned on that slide obviously relate to the financial position at the year end, which, as I said, was slightly better than break even. Capital cost absorption rate, and I wouldn't want to bore anyone with accountancy speak, so I'll just keep it that it's basically a measure of the return that we have to make to central government in terms of our expenditure. External financing limit is relating to how much cash we can use in the course of the year, and we complied with that. And as I just mentioned, I talked about capital, we have a capital resource limit that we have to live within. We can add to that from disposal of our assets, and we managed to provide our capital expenditure within that limit for the year. Thank you. So I think looking forward, I think we're going to be talking about our priorities, and I think I'm handing over to Tom, who's I still say new, or relatively new, Chief Exec.
Thank you, Kevin. So hi everyone, I'm Tom Abell, the new Chief Executive. I think I'm 5 weeks in, so I think that still qualifies as new. And I just want to take this opportunity to thank everybody on the board and also everybody I've met so far at the Trust for being so welcoming. It's obviously an incredible privilege to take over as Chief Executive of the Trust, and I'm really pleased to have got started. Just before I kind of dive into the priorities and the forward look for the organisation, I wanted to also just put on record kind of my thanks to Tom Davis for everything that he's done since acting up as Chief Executive through what's been a really challenging time for the Trust, both in terms of the operational pressures that we've seen, but also the regulatory concerns and issues that we've had. So he's done an incredible job, and I'm incredibly grateful for him in terms of the position that he's left us in and the foundations that he's helped us to build. So I think the one thing that strikes me as I get out and about across the Trust is the incredible commitment of our people, in regardless of what they do. In particular, I've been incredibly impressed by the work and commitment of our volunteers and community first responders, who I think have contributed massively to our work, and I look forward to working with everybody as we move forward. As you may know, since the CQC visit over the course of the last year, we have had visits and inspections from a number of other regulators from different areas, so including organisations like Ofsted and working with organisations like the Equalities and Human Rights Commission, which clearly indicates that we've got a lot of work to do as an organisation to improve our culture, to improve the way that we work, to make sure that our staff and communities have an excellent experience of either working with or receiving care from East of England Ambulance Service. And we have some major challenges in terms of particularly about how people behave towards one another and how we make sure that our people are appropriately supported to be able to do the job that they want to do. So I think the way that we tackle that is we tackle those head on. For anybody who was at our board meeting earlier today, you'll have heard and seen the conversation we've had about how do we strengthen our procedures around freedom to speak up, how do we make sure that we take firm and effective action where we have problems, and how do we resolve concerns sustainably. So to do that, I think we are moving on to a phase of work around how we chip away at these problems that we've got within the trust, and work on this has already started, so this isn't new. And the way that we're starting to think about that is in 3 stages. How do we fix some of the issues that we've got? Secondly, how do we fix permanently those issues and to embed the change and the improvements that we want to see within the organisation, and then that providing a really solid platform that we can look to transform the way that we work and transform our service and delivery. And we're doing that across a whole range of different areas at the moment. So one of those, for instance, is recognising the fact that this is a long-term job and it's going to take a number of years to see some of the improvements that we're going to want to see. Is we've started the process of substantively recruiting to a number of posts within our executive team. So our leaders have the time and capacity to be able to do this work and also to develop others within our trust. We're secondly, given some of the operational pressures that Paul mentioned earlier today, making sure that we are working with our commissioners and system partners to make sure we've got the resource we need, both to deliver the service today and through this winter, but equally going into next financial year, and talking quite frankly about some of the issues that we've got, because until we recognise the fact that we've got some problems and recognise the fact we've got to fix some of those problems, it will always inhibit our ability to identify and challenge some of those. So we will be taking a step-by-step approach, and we'll be talking about that through our board meetings and through some of our other engagement events that you are more than welcome to attend and get involved in. For the longer term, I've committed to our stakeholders that we will be publishing a roadmap before Christmas, which will set out the improvement journey that we intend to go on as an organisation, and the step-by-step approach which we intend to take in terms of fixing, embedding and transforming the way we work as an organisation. Obviously, I think what you've heard today is a lot of the really fantastically good stuff that we do, and I think you can never get away from that in terms of we've got fantastic people delivering fantastic services, but we do know there's always more to be done, and we also know that we've got a number of big challenges that we've got to face. But I think based on all of that fantastic work and some of the fantastic people we've got a really great foundation on which we can build our future and continue to care for and improve the care we provide to our patients and communities across the East of England. I think I will leave it there, Nicola, and I think we're open to any questions now.
Thank you very much. I think I'm now live. So thank you everybody, all the executive team there for painting such a vibrant and extensive picture for our progress during the year. And I think it was really helpful, Tom, then just to pull it back into the challenges that we're still to tackle and we're still to deal with, but we're establishing a very structured approach to that and clarity around our fix, embed and transform approach. And so I think we don't have any questions from any attendees. I'd just like to check in with our head of governance that nothing's been logged in a place that I haven't seen, and no signals for that. No, so I'm getting some nods from off screen, some shakes. So I'd just like to thank everybody that's taken the time to dial in and listen to us, and anybody that's listened to us after the event as well. Really positive steps forward and great optimism for the future, and I look forward to seeing you all this time next year to report on what I know will be a very successful year. So thank you very much, everybody. Thank you.